first day of March 2020. I'm Sabah Fakuri for the Heart and Home podcast. On this spring-like day where it is felt in much of the world, signs of new life are beginning. However, despite this week, the Centers for Disease Control and Prevention telling Americans to prepare for a significant disruption of our lives, I will share a few steps you should take to protect yourself from the coronavirus. But please don't be alarmed. If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain how I found out about this. It's free. It's on your app store. There's a creation tool that allows you to record and edit your podcast right now from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. Please, I urge you, don't waste another minute. I wasted 3 years. I attended all kinds of events to learn all the steps. I was so confused, and it was right here. Download the free Anchor app or go to anchor.fm to get started. Do it now. Did news of the first death in Washington state of a man in his 50s send you to the grocery store yesterday to stock up on supplies of medicine, paper, and canned products, and face masks? Despite assurances so far, this virus is not as deadly as other outbreaks. People who want to prepare should keep a 2-week supply of food and water and a 30-day supply of your prescription medicine. The first death in this country was a chronically ill patient who died at Evergreen Health Hospital in Kirkland, near Seattle. Officials don't know how he was exposed to the virus. That state has 2 other coronavirus cases at a long-term care facility in Kirkland. A healthcare worker in her 40s who's currently in stable and satisfactory condition, and the other one is a woman in her 70s who had lived there and is in serious condition. However, another 50 residents at that long-term care facility in Kirkland are also showing symptoms. The first U.S. coronavirus death capped a week of stock market upheaval as the virus infected more than 60 people in this country. Most of the cases in America are from travelers who were repatriated from China where the virus originated. But a new concept surfaced this week of coronavirus cases in California, Washington, and Oregon with no ties to China. I looked at the numbers, and compared to the flu, this virus causes 12,000 deaths annually in the U.S. Despite those numbers, I still don't get a flu shot every year. Even if it's free, I continue to refuse it at my doctor's office and at my local CVS. I was in the drugstore yesterday and I witnessed an elderly person receiving the flu vaccine. But no, I'm not interested. I got the vaccine once, and because I got sick from it, I vowed never to take it again. It's been 45 years. Meanwhile, I have had several bouts of food poisoning that were the worst days of my life. Currently, there is no vaccine against the new coronavirus, but I doubt I'd take it if there were. Tomorrow, President Trump will meet with the bio companies to discuss developing a vaccine for the coronavirus, which will take 1.5 years. President Trump continues to assure Americans there is still no reason for panic. He said, "We would respectfully ask the media and politicians and everybody else involved not do anything to incite a panic because there's no reason to panic at all. This is something that is being handled professionally. This too will end." In the meantime, if you're wondering whether to wear a face mask, health officials say they don't help prevent being infected by the virus because the fit isn't tight enough to prevent breathing in infected droplets. Face masks have been a common sight in East Asia for years due to poor air quality. In fact, the 18-year-old musician Billie Eilish, who swept the Grammys this year, often wears a mask. She even collaborated with Urban Outfitters to make a mask, which is now sold out, by the way. Fendi, which is a little bit more expensive, has its own pollution mask. Face masks have two purposes: safety and anonymity. The face mask is a trend, and even some Instagram influencers are using them as part of their looks. In Washington on Capitol Hill, House Speaker Nancy Pelosi said lawmakers would take up a coronavirus spending bill this week to advance a strong emergency funding supplemental package that fully addresses the scale and seriousness of this public health crisis. We don't know how serious it is, Nancy. In China, the death toll is at 2%, despite the high number of COVID-19 infections. The deaths have affected the elderly, people in their 70s with pre-existing medical problems, and smokers are at higher risk. Otherwise, most of the cases are mild. 3/4 of the people experience a low level of fever and cough. Some are fatigued, get headaches, and in some cases, diarrhea. In yesterday's episode of Heart and Home, I shared an email from Anita Murjani, who survived the 2003 outbreak of the novel virus SARS in Hong Kong, which had a 10% death rate. The MERS death rate was even higher at 34%. So the coronavirus is only at 2%. So yes, it is a low risk. Health officials advise preventive measures for the coronavirus are the same as flu prevention. Wash your hands. Wash your hands. Wash your hands. Wash them with soap for at least 20 seconds, especially after using the restroom, before eating and after blowing your nose, coughing, or sneezing. Cover your mouth with a tissue. Also, I've been covering my hand with a napkin or my scarf when touching doorknobs, elevator buttons, and other public surfaces, such as counters and escalators. Earlier this week, I had to take my mother to the hospital for a test. I noticed she kept her gloves on, which is another good way to protect your hands from surfaces. Try not to touch your face, especially your eyes, nose, or mouth. I also carry a disinfectant wipes in my car and wipe down all surfaces daily, especially if you're transporting school-aged children. And refrain from hugging or shaking hands. As previously mentioned in an earlier episode, you can wave, nod, or bow, and do an elbow bump. More importantly, stay home when you're sick, and keep your kids home as well. I'm more concerned for them. I'm not in a panic, nor am I fearful, just taking preventative measures such as postponing unnecessary travel. Travel warnings for Americans include China, South Korea, Iran, and parts of Italy. American Airlines suspended all flights to Milan following a level 4 do not travel advisory by the U.S. State Department on the Italian regions of Lombardy and Veneto. The first case in Italy surfaced at the end of January when 2 Chinese tourists from Wuhan, which is the Chinese city that is ground zero of the deadly virus, fell ill during a trip to that country. The couple was put into isolation and are not believed to have infected anyone. Yet, Italy became the first in Europe to ban all direct flights to and from China. Several weeks later, On February 21, Lombardi announced that a 38-year-old Italian man, Mattia, from the town of Codogno, 40 miles southeast of Milan, had tested positive for the virus. Within a week, 888 people were confirmed to have caught the disease, of whom 21 have died. When Mattia first showed up in the Codogno emergency room hospital on February 18, his symptoms didn't raise any alarms because he had not been to China. The next day, he returned after his condition worsened. In both visits to the emergency room, he wore no protective mask and was near other sick patients in the emergency room before he was eventually diagnosed. He infected 5 workers, his pregnant wife, and a friend. And those people unknowingly spread the disease before going into quarantine. No one knows who brought the illness to northern Italy. Scientists initially believe the unwitting patient 0 might have been a colleague of the Codogno patient who had recently returned from a business trip in China, but he tested negative. Meanwhile, in France, this Sunday morning, the world's most visited museum, the Louvre, in Paris, has temporarily closed for a staff meeting about the coronavirus outbreak, which left long lines of disgruntled art-loving tourists snaked outside the museum doors. The museum are not covered by yesterday's French government orders to cancel, until further notice, all public gatherings indoors or in confined spaces with more than 5,000 people. As a result of the ban, however, the annual Paris Farm Show was closed yesterday, one day early, and today's half marathon in Paris, where 40,000 runners were expected, was also canceled. Did you notice French President Emmanuel Macron gave Premier Giuseppe Conte a double cheek kiss on 2 separate occasions during a Franco-Italian summit in Naples this week? They're trying to send a message not to fear their neighbors as the new virus from China spreads, with Italy as Europe's hotspot. Friendly kissing in the time of coronavirus is expected to reshape normal customs, however, such as the common handshake. Yesterday, French Health Minister Olivier Véran advised people to cut back on la bise, the European custom of greeting with kisses, along with handshaking. France currently has 100 coronavirus cases and 2 deaths. And finally, in South Korea this Sunday, places of worship are closed across that country. South Korea is battling the worst coronavirus outbreak outside China, with 3,736 cases and 18 deaths. For the Heart and Home podcast, I'm Sabah Fakuri. Thank you for listening. Have a wonderful Sunday, and I'll talk to you tomorrow.